Good evening. My name is Kathy Rankin. I'm going to discuss with you tonight teamwork and collaboration according to the QSEN model. Um, Teamwork and collaboration. Um, Teamwork and collaboration. The definition is to function effectively within nursing and interprofessional teams, fostering open communication, mutual respect, and shared decision making to achieve quality patient care. And some of the objectives that I will be discussing tonight will be to identify nursing students' preferences, um, into teaching strategies in psychiatric nursing. Also, to investigate nursing students' perspectives about the role and the role play as a teaching strategy in psychiatric nursing. To explore the relationships between students' academic level and their prospective roles as a teaching strategy in psychiatric nursing. Psychiatric nursing also examines the relationship between students and their about their role and a role play as a teaching strategy in psychiatric nursing. Some of the guidelines or some of the objectives that we will be discussing will be um, to demonstrate the signs and symptoms of a psychiatric disorder appropriately, as well as comprehensively, to demonstrate skills of therapeutic communication, to demonstrate comprehensive assessment skills, also to provide relevant nursing care for simulated cases, because we will be doing simulations, as well as psychopharmacological and other treatment options relevant to the simulated case. So we will be doing simulations, and some of our objectives for the pre-licensure QSEN model would be to describe scopes of practice and roles of healthcare, as well as the healthcare team, to describe strategies for identifying and managing overlaps in team membership roles and accountability. Also, the student must recognize contributions of other individuals and groups in helping patients and families achieve their goals. And one of the skills that's required for that would be to function competently within your own scope of practice as a member of the healthcare team, as well as assuming the role of the team and becoming a member of the team, or even a leader based upon the situation, because psychiatric nurses have a diverse role, because they not only deal with the families, but they deal with the patient as well, and the patient's family play a big role in the treatment process of the client or the patient. They must initiate requests for help when appropriate to a situation. They must clarify roles and accountabilities under conditions of potential overlap in team members' functioning. That means that they must ask for help when they need help. They must integrate the contributions of others who role play in helping patients and their families to achieve the goal, because the main purpose of the team is to assist the patient in his well-being and overall health. And one of the objectives in the QSEN model is to value the perspectives and expertise of all healthcare team members, as well as respecting the centrality of the patient and the family as a core member of any healthcare team. Family is as important to the team as the student or the instructor and the patient. Respect the unique attributes that members bring to a team, including variations in professional orientations and accountability. The student must analyze the differences in communication styles and preferences among members of the team, as well as the families and nurses and other members of the healthcare team. We must describe to assist the student in describing the impact of her own communication style on others. We will discuss with the student communication techniques as far as adapting their own style um, of communicating and to the needs of the team as well as to the client, demonstrating commitment to the team goals. And to accomplish this means that the student will value team members and the relationships upon which other relationships are based and value differences in styles of communication as well as communications used by patients, families, and healthcare providers. The student must be aware of her own feelings. She must describe examples and the impact of the team functioning on safety and the quality of care. Explain how authority gradients influence teamwork and patient safety. Follow the communication practices within the team and within the hospital or the administration or wherever they prefer to work. This means that um, when you give a report, you must clarify your position, give an give report, and that means when you hand off among providers and across transitions in care, you must assert your own position and perspective in the discussions about the patient and about the patient's care. Appreciate the risks associated with handoffs among providers and associate transitions in care. Um, she must describe the examples of the impact of the team functioning on safety and the quality of care. Explain this. Explain how communication styles may diminish and also risks associated with other team members. Appreciate the risks associated with handoffs among providers and across transitions in care. Value the influence of system solutions associated with effective team function. Participate in designing systems that support effective teamwork. Um, that means that you identify barriers and facilitations of effective team functioning, as well as examine strategies for improving those systems to support team functioning. And now, one of the things that we would like to do, especially in psychiatric nursing, as it applies to our patients, because psychiatry is a specialty area, and students must learn to role play. They must demonstrate the signs and symptoms of the disorder appropriately and comprehensively. Identify their preferences of teaching strategies in the psychiatric nursing field. Investigate their perspectives about role playing as a teaching strategy used in psychiatric nursing. And students should, another objective would be to explore the relationship between students' academic levels and their prospective roles, and role play as a teaching strategy in psychiatric nursing. Examining the relationships between students, their grade point averages, and the prospective role play as a teaching strategy in psychiatric nursing. They must be willing to listen and be willing to demonstrate comprehensive assessment skills, demonstrate accurate and relevant history taking tools, be available to listen to their patients as well as their instructors, and doing role play, collect data using questionnaires, history taking, provide the patient with understanding that you care and that you want to be a psychiatric nurse, because there are different types of activities to role play with the patient as well as in the classroom before you go out on the floor, learning the different styles, learning how to be an effective psychiatric nurse, because the patients are, if you're dealing with the schizophrenic or if you're dealing with bipolar disorder, a lot of those patients are paranoid schizophrenics and they don't understand what we're doing on the floor. They're there because they have an illness, and we're there because we're providing a service to our patients as well as to our institution. So when we go out on the floor, we must be prepared. We must be prepared because the cognition in our older adults with bipolar disorder versus the major depressive disorder, sometimes those disorders um, will be confusing. So bipolar disorder and major depressive disorder are associated with cognitive dysfunctions even when the patients are dishonest. And both disorders are associated with increased rates of dementia. So the thought processes are distorted. And you have patients that are depressed. And when you're dealing with a patient with depression, you must show compassion. And also, in showing compassion, that means that you identify whether there are relevant differences that may help you as well as the patient understand the neurobiology of the illnesses as well as developing specific interventions. So the student must be prepared as well as set the objectives that she's going to teach. When you go out there to teach, the patient doesn't understand, this person is here because they may feel like you're there to harm them, or they may be feeling so depressed that they may not even want to talk. The first thing that you must do is build a rapport with the client and show the client that you're interested in what they're as what in that that you're interested in what they're thinking or what they're feeling. And if they don't want to talk, come back later. But psychiatric nursing requires a great deal of skill as well as role play, and we must explain why we're there and use those skills that are relevant to that particular patient and the patient's care. And our attitude, we must appreciate the necessity of all healthcare professionals to seek lifelong continuous learning of the skills that are needed and value those relationships between the university, wherever you're working, or even on the floor. And discuss patient care amongst each other before you go out on the floor to be an effective team member as well as a professional. And because the patients definitely depend upon us to provide the best care that we can. And this is the end of my presentation.